So for COVID and many other things, all of the things that we normally do in a healthcare facility are designed to reduce the risk of transmission. That's why we do them in the first place. It gets to environmental services work. Our EBS staff are crucial components of a safe healthcare environment. They not only need to identify the right places to clean, but they also need to use the right materials, use them the right way, and make sure that they stay on for the right amount of time. This is not a trivial thing. I will put in a pitch for our EBS colleagues. If they want to come in and clean something, please encourage your colleagues and your patients to let them in. Let them keep us safe because what they do is so very valuable. Having said that, that is one component. It's one component of environmental cleaning, as well as safety in general. For environmental cleaning, it's important for all of us to realize that EBS staff aren't responsible for everything. There are some things that they're either not allowed to touch or worried about touching. And so, for example, think about a mechanical ventilator control panel. I can understand how an EBS staff member would be very anxious about touching anything there. And that raises the question, well, in that case, who does clean that? And it doesn't really matter who it is. If it's the respiratory therapy team, great. If it's environmental services and they're comfortable doing it and know how, terrific. If it's the ICU nursing staff who decide to take it on, that's okay too. But someone needs to be wiping it down the right way with the right stuff on a regular basis so that we don't have a source of cross transmission. Understanding who's responsible for cleaning what is really important. Pulse oximeters that sit above an ICU bed, how often do those go back to central supply for reprocessing? It's an important question to think about. And if you don't know the answer, ask your team, find out from your charge nurse, find out from your EVS staff or central supply or respiratory therapy. But as you can see, it's never a single answer about who's responsible. And this is why it's so important to have a functioning team that communicates. If you never talk to these other parts of the care team, it makes it much more difficult to figure out what's going on and what needs to happen. So thing number one is routine cleaning. The good news with COVID-19 in particular is that we don't need any special chemicals. This is a respiratory virus that has an envelope. You've probably heard the envelope phrase. For those of you who are wondering, viruses are little tiny structures made out of protein and other elements, but they tend to have, if they're envelope, a fatty membrane surrounding them, a lipid envelope. That makes them susceptible to any kind of detergent. So soap and water on our hands works really well to destroy the envelope. Think about how dishwashing liquid disperses fat when you're washing dishes. That's what's happening with the lipid membrane of the envelope virus. So that's a really good thing. Alcohol destroys the membrane as well and makes the virus no longer infectious. So for those reasons, our hand hygiene approach can be standard. We just need to make sure we remember to do it. For environmental surface cleaning, the hospital disinfectants that are registered by EPA are all very reliable. They do a good job. As always, they need to be applied correctly. You can't have a box of wipes that has the lid sitting open and they're all dried out. That's not going to work. So making sure things are done correctly remains key. There's a list. If you're running a small facility and you want to make sure that the chemicals that you're using are appropriate, there's a list N as in Nancy on the EPA website that has a list of all of the products that are appropriate for COVID-19. But the good news is if you're in a major healthcare setting and they have a standard hospital disinfectant that they've been using that correctly is sufficient. So the environmental surface piece is one component of staying safe. The air handling piece that I've mentioned several times recently is really important, and it gets to the team effort concept again. If you don't know who your facilities management person is for your part of the facility, if you haven't had a conversation with the facility's owner that you work in, now's a good time. Understanding as we go into wintertime, what the air handling is like, how much fresh air is being brought in, whether it's being filtered, where the air exhaust is. All of those things need to be managed correctly. and brought up to par. There are very clear standards for all of these facilities' air handling requirements, and those are available online as well. One thing that I'll say that's super important to think about, um, for negative pressure isolation rooms, if you're using them for procedures on COVID patients or any other reason, they need to be working. And that means we need to know what the gauge is, what the gauge reading is. Is it still at negative pressure? Sometimes the gauge isn't at the nursing station. Sometimes it's downstairs away from where patient care is happening. If that's the case, you need to know who to call and find out if they've looked at the gauge and everything is okay. So making sure that a negative pressure room is truly negative is important. Why is that important? Something as simple as upgrading a filter for the HEPA filter system can completely change the balance of air. We've seen several situations over the past many years where somebody upgraded their filter, which is good, but that created more resistance to airflow in the air exhaust system for the negative pressure room. And so rather than force through, it backs up out the door again. And so what was a negative pressure room suddenly became positive pressure. This is also why if you have a colleague who's doing the infection control work for your facility, they're really focused on elevators. If there's elevator repair or maintenance happening and the doors are propped open, every time the elevator car goes up or down, that is acting like a plunger in a syringe, forcing air in and out of your floor. And if you have a negative pressure room or if you have a protective isolation room for cancer patients, that can completely change what you think is happening. So air handling in those special scenarios is also very important to check. Lastly, thinking about um, what you can do to optimize air handling for what you're going to do. So there's routine air handling for just being in a clinical area. That's important. But if there are special procedures, whether they're things like triage to understand whether a patient needs to be brought into isolation or can go into the regular hospital community, doing that in a place that prevents unanticipated exposure is a good thing. In many places, weather permitting, doing some of that work out of doors so that you have the best possible air exchange is a great solution. When you think about how can you make a facility safer, making sure that everyone in the facility is practicing source control all the time. It's an important part of the holistic approach to making things as safe as possible. The last piece of the pie, if you will, is procedural. Having procedures that optimize the safety of our healthcare staff. I said earlier that long durations of exposure are associated with more risk than a short exposure, and that makes a lot of sense. And so if there's a way to spend less time in an at-risk procedure, then we should do that. So for example, if a procedure is going to be undertaken for a patient with COVID-19, rather than having everybody in the room together waiting to get the procedure started, getting set up outside, bringing the equipment in, and then when the procedure is ready to happen, bringing your colleagues in to do it, and then getting out again as quickly as you can safely, that makes sense. It's just a practical approach. Similarly, if a patient is being moved from room to room, it doesn't make sense to have them waiting, even with their mask on, in a hallway for a long period of time, right? That's unnecessary. And so reducing that exposure period is a smart way to work. Triage, I mentioned, trying to do it where air handling is good, but also figuring out how to do it in a smart way. Many facilities have gone to cell phone triage. And that is, I think, a very practical approach where individuals wait either outside or in their car and are called in by phone when it's time for them to be seen. That, I think, is a practical approach in some settings. That's how my dentist works. It's apparently how the guy who cuts my hair works, although I haven't been there for about 6 months. I figure if the Cheesecake Factory can do it, we can do it in healthcare too. So, that is another approach that we can take to improve safety.